Canine atopic dermatitis is one of the most common ailments seen by veterinarians. Do you have a firm grasp on the diagnostic clinical features? This brief on-demand veterinary dermatology presentation will review a validated checklist that you can use to arrive at an accurate diagnosis. The presentation was prepared by Dr. John Plant, founder of Skin Vet Products and the developer of Respite, regionally specific immunotherapy. Dr. Plant has practiced veterinary dermatology for more than 20 years. He was a faculty member at Oregon State University for 3 years, has published scientific articles on canine atopic dermatitis, and served the American College of Veterinary Dermatology as the examination committee chairman. He is on the executive board of the Portland Veterinary Medical Association, and he was selected as a member of the International Committee on Atopic Disease of Animals and is the dermatology section editor for the Journal of the American Animal Hospital Association. Veterinary dermatologists rely heavily on a patient's history to make the diagnosis of atopic dermatitis. At a minimum, you'll want to document the severity of their pruritus and their dietary history with an emphasis on the thoroughness of any hypoallergenic diet trials and the protein sources that have been fed in the past. You need to know if they spend most of their time indoors, whether the signs are seasonal, at what age the first signs developed, whether the pruritus has responded to cortisone, and whether or not they've had recurrent cutaneous yeast infections. Perhaps the most important aspect of the dermatological examination when it comes to diagnosing atopic dermatitis is the distribution of the lesions on the pet's body. Examine their ears, feet, and underside. It really helps to have good natural lighting or an examination light to detect fleas and identify cutaneous lesions. The body regions most commonly affected in canine atopic dermatitis are illustrated in this drawing from the Canine Atopic Dermatitis Lesion Index that Dr. Plant developed for scoring lesion severity in atopic dogs. The formal diagnostic criteria used to diagnose canine atopic dermatitis have gone through several iterations over the years. The most current, published in 2010 by Favreau and others, is the best studied, having been rigorously validated in over 1,500 dogs by 34 veterinary dermatologists in 15 countries. Data from 843 of these dogs diagnosed with atopic dermatitis was prospectively evaluated for dozens of clinical features. These features included information from the history, the physical examination, and the allergy test results, which were considered possible predictors of final diagnosis of atopic dermatitis. A statistical analysis was then performed to reduce the list of evaluated features to those that were most useful for making the diagnosis of atopic dermatitis. The list that provides the best combination of sensitivity and specificity for clinical practice includes 8 features. In this study population, when 5 out of the 8 of these features were present, the chances were good that the diagnosis was atopic dermatitis or food-induced atopic dermatitis, conditions with very similar clinical features. None of the items on this checklist will come as a surprise to you, but it can be helpful to ensure consistency in our diagnosis of atopic dermatitis. A copy is available as a document attached to this presentation. While the checklist is useful, the specificity is not 100%, so you'll still need to rule out some important differential diagnosis, particularly fleas and food-induced atopic dermatitis or food hypersensitivity. Some other causes of canine pruritus should be ruled out as dictated by your findings. A history of a pet owner becoming pruritic or finding crusts and alopecia on the elbows or pinna margins are suggestive of sarcopic mange necessitating a therapeutic trial. If pruritus began only as an older dog, the possibility of cutaneous lymphoma is higher on the differential list than it would otherwise be. In summary, take a thorough history and perform a dermatological examination that will allow you to evaluate the clinical features on the diagnostic checklist for canine atopic dermatitis. Rule out food-induced atopic dermatitis and fleas. Rule out additional pruritic skin diseases as dictated by your findings. Use these guidelines regularly to make an accurate diagnosis of canine atopic dermatitis. Once you've made the diagnosis, you're ready to prescribe Respite, the most practical approach to allergy immunotherapy.